Welcome back to Beyond the Scalpel. I'm one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can learn more about us at plasticsandderm.com.
So we have a pretty exciting show. We're talking about, for lack of a better term, we'll call it tweakments.
Tweakments.
We have a great guest, Alice Hart-Davis will come on later, who can definitely add to this discussion.
Yes, and we got our term tweakments from her because she has a website, thetweakmentsguide.com, which I think is great.
So we're talking about little things that do not require anesthesia, things that have basically no recovery time in terms of downtime from work, life, and things like that. And there are so many to talk about. We'll try to get to as many as we can.
Yes, so little tweaks. And often these are tweaks that people don't think about, so they don't necessarily come in asking for them. So I'm going to start with talking about one of my first favorite tweaks, and that is the liquid rhinoplasty.
Pretty amazing stuff. So I would say that liquid rhinoplasty would not come across as cutting edge right now. I've been doing it for a long time. I think that it is not a straightforward procedure. It looks straightforward, the idea of, you're trying to hide bumps or create better tip contours or little things like that. But you really need to know your nose anatomy.
Well, sorry to cut you off. I just want to explain what a liquid rhinoplasty is for people who don't know.
Sure.
Even though it has been around. But it basically means using a little bit of filler to reshape your nose. And a lot of patients do not realize what a dab of filler can do for the shape of your nose. And people will often come in and they'll ask me about my husband, Dr. Elie Levine, and can he do a rhinoplasty? And of course, I discuss with them the rhinoplasty, the surgical option. But there's times where I note that a little bit of filler will serve the purpose. So
yeah,
go ahead.
You're absolutely right. So I would say that it's rare that I use even half a syringe for a nose. It needs so little to make such a dramatic difference. It does require the practitioner to really know their anatomy of where they're placing it. So it is risky. And you have to know your nasal anatomy. So you need to do a lot of rhinoplasties as a surgeon to feel comfortable doing this correctly. The other thing that I find really remarkable about it is even though I'm using a hyaluronic acid filler, and most hyaluronic acid fillers last, let's say, up to 6 months or so, somehow in the nose, I find that they last a year or more. And my patients that I've been treating for like over 5 years, it's almost like they don't need it anymore. So they'll come in at like 2 years and they'll say, do I need more? And I'll be like, no, you may need something else, but you don't need that.
It makes sense because basically hyaluronic acid is a sugar and it gets metabolized, broken down by the body over time. And areas that move more have a higher metabolic rate and it gets metabolized more there. So filler around the mouth where you're constantly moving, at least I am, that goes away quicker. Filler under the eyes can stay for a year because you don't really move that area. And certainly your nose, you're not moving.
I have a different theory too. Not really tested or proven, but to me, I break down good scar tissue and bad scar tissue. So whenever you're manipulating an area, there's an element of scar tissue being formed. Now, bad scar tissue is something that has a cosmetic problem or has a functional deformity, a pain or anything like that. And good scar tissue, when you're adding it to an area of volume, is if it creates that volume. And so if you permanently get correction of that area, and whether you have residual hyaluronic acid or whether there's some good scar tissue that's hiding a bump, well, great. Either way, it works for the patient.
Yeah, for sure. I think the filler itself lasts longer because that area is not moving. And the reason why people need less over time is because the buildup of collagen, or we can call it scar tissue, which doesn't sound as good, but that is what it is. Okay, so liquid rhinoplasty, that's our first tweakment.
Yes.
Okay.
Let's talk ears.
Ears. Yes. Love ears. Okay. Do you want to tell us?
So what do you do for ears, and what is the issue that you tweak with ears?
Okay. So often I put a little bit of filler at the bottom of the lobe so that people can hold on to their earrings, their studs better. As we age, we lose collagen, we lose elasticity, and your earlobes begin to get long and thin. So a little bit of filler can reshape that lobe and also provide support for your earrings. I think I mentioned this in one of our prior podcasts. I don't know if we spoke about the surgical options that you do for earlobes.
Yeah, so there are two things that I find cool for earlobes. So along the same lines, if someone has, they feel like their earring is not quite sitting right, they're worried even that it's going to fall out. So the starting point is things like filler. It's quick, it's easy, no recovery time on it, and it addresses the problem right away. But if someone's looking for, if it's more severe, or they're looking for something lasting, and it affects so many people, whether it's a heavy earring pulling on it, whether it's not great, earlobes to begin with, like in terms of a lot of strength to it,
Right.
or whether it's snagging on a sweater when they're wearing their ears,
Yes.
or whatever it is, it can almost tear through.
So what do you do?
So you can actually, what you do is you essentially close up that opening completely, and there are a couple different ways to do it. It takes all of half an hour at most. And then you re-pierce it. You start all over again, and it works brilliantly. The ear shape is the same. The ear size is the same. It is something that I do quite frequently because it is, unfortunately, a real problem.
So you're referring to an earlobe repair.
Correct.
Okay.
Now, my cooler procedure, I'd say,
Yes.
is parts of our body grow as we age, and generally those are not good things. So like your nose can hang down and grow more, where someone could say, I have a perfect nose at 20, and all of a sudden at 63, they don't feel like they have a perfect nose.
I used to have a little button nose.
Still do.
I don't know. Okay, go ahead.
And earlobes. Earlobes grow. Ears in general grow, but earlobes grow. And a lot of women will notice that your earlobes just don't look great. And so you can actually do an earlobe reduction. Also takes at most 45 minutes to an hour. Basically no downtime from life. And it's dramatically
Yes,
better. It's
I have seen some of those results. It's better.
Yeah, so sometimes I'll do that by itself. Sometimes I'll do that at the same time that I'm doing a facelift anyways, because we're working around that area anyways. It's an easy time to recover. It's no big deal. And it doesn't really change anything, which is great. So it is pretty amazing. And I would say that there's some women even in their 40s that are noticing it. And obviously you notice it as you age more, it becomes more of an issue as you age more, but even younger people.
Yeah, 40s, guys, that sounds young. Okay, since we're still on the face, another tweakment that I would like to speak about are threads, PDO threads in particular, polydiaxonome. It's a synthetic absorbable material. It's a surgical suture that we put into various places to contour the face. I use threads to lift the brows. I use threads to lift the mid-face, to lift the jawline. I also use them on the neck. And it is such a great procedure because there's no downtime. You're fully awake. It just involves a little injection of anesthesia at the location where you are going to enter the thread, and a little injection at the location where the thread will end. And the whole thing takes 20 minutes, depending on how many threads we're putting and where we're putting them. There are different kinds of threads. The threads I've just discussed are barbed threads that actually pull areas. There are also smooth threads that build collagen, and twisted threads that provide a little extra fill, sort of almost like a filler. And one more thing I just want to talk about with threads, because I don't want to monopolize, is one of my favorite uses for the twisted thread is on the lip, on the border of the lip. It is so nice and subtle, but I love it. I put a thread along the lip border on the top and on the bottom, and it really defines the border of the lip so nicely. Barely hurts, no bruising, and
so here's my question.
Great tweakment.
Here's my question.
Yes.
Is that this is new and not new. So threads were around, I feel like it was like a decade ago, and they came and went. There were problems with them. They just either, and didn't do what you wanted, or they had extrusion, or they had issues like that. So my question is, what's better about the threads today? And they are. You're very much happier with them now. So what's better about them?
The threads today are made from a different material. They are not permanent threads. Anything permanent put in the face, for the most part, most things I am not a fan of. Your face changes over time, your face falls. You don't want a thread somewhere in 10 years from now where it was 10 years ago. It makes no sense. But the material that is used now is a monofilament, which means it's one material, so it cannot harbor, it's less likely to harbor bacteria. It is absorbable, so it's not there forever. And it is just a very beautiful, provides a beautiful result.
Yeah, and it's using a material that essentially is one of the main stitches that I use in a lot of procedures. I use them in tummy tucks, I use them in breast reductions, I use them in brow lifts, I use them in a few different procedures. So it's something that's been around for a while and safe and effective with it.
Yes, and most of our barbed threads that I'm using for the lift, they last about a year. The results last about a year. The threads themselves are not there the full year, but the result I find lasts a year. I basically repeat the procedure yearly.
So let's switch gears a little bit.
Okay.
We've spoken about hyaluronic acid. We've spoken about fillers, and we will probably speak about that a whole lot more because there's so much to talk about. But there's something new out there, which falls under the tweakments, that is using hyaluronic acid, but in a different way.
Yes, this has become very popular. The product you're referring to is Skin Vive, correct?
Correct.
Okay, Skin Vive is very interesting. It is these micro droplets of hyaluronic acid that currently are approved for the cheeks only by the FDA, although in Europe they're using it at many other locations, and here they're potentially using it, people are using it off label elsewhere as well. But basically hyaluronic acid attracts water, and it's essentially creating an internal moisturization of your skin.
So you're injecting it in the skin?
Yes, in the dermis, but they're micro droplets, little droplets of it, and you see the results. Right away you look better, but ideally the results show up in 3 weeks and last about 6 months. And it gives your skin a glow, it hydrates your skin, just makes your skin look better. Because as we get older, we lose hyaluronic acid. We lose hyaluronic acid, which naturally exists in our skin. We lose it with age, we lose it with sun exposure. So this is basically replenishing the hyaluronic acid, not as a volumizer or a lifter, not as a filler, but rather as a moisturizer. Or a hydrator, I should say, not moisturizer. Yeah, it's actually great, and we are going to see a lot more of these products coming out because there are some that are approved in Europe and not yet here. So this is just the beginning.
I'd like to say they'll be in the market any day now, but
no. You know, as we're going to discuss later with our guest, things often come to us from Europe.
Right.
And you know what? I think it's a good thing.
I think there's a good and bad. Yeah. I mean, the bad is that it takes us a whole lot longer to get stuff. And even stuff that we kind of know is pretty safe. We're not talking about experimental stuff. We're talking about tweaks of things we already use. That's kind of the bad part. The good part, of course, is these things are vetted better.
Right.
And so we have a better confidence in terms of their safety before we start treating patients.
Exactly. And often, as soon as I introduce something new to my practice, my patients want to know how long has it been around. And that is a very valid question. And I personally want to know that as well before I'm willing to use it on my patients. And it's helpful to say, well, it's new here. However, it's been used in Europe for 10 years.
Right.
So that does help a lot. Okay, tell us another tweakment that you would like to speak about.
Yeah, go ahead.
No, we focus a lot on nipples, I feel like, in our podcast. I don't know, they're just, for some reason, they've been on our minds lately. I think ever since your post article about shaping nipples like Beckham.
Yes.
But anyway, inverted nipples, isn't that a nice tweakment?
Yeah, it's a great treatment. It's an hour-long procedure done under local. It's not something that all women or most women feel that comfortable talking about, having inverted nipples, but it obviously, if you have inverted nipples, it can be a challenge to nurse. And as kind of the fashion world has made it more acceptable or likable to show nipple through clothing, whether it's to...
I hate that trend, by the way, but go on. Yes, I know you like it.
I like it. I'm not weighing in. I have an opinion.
To show my nipples.
Okay, you know?
No.
Okay.
But go on.
Okay.
Yeah.
Anyways, as it becomes more fashionably acceptable, a lot of people are coming in and seeking that out. And it's an hour-long procedure. You know, they can be back at work the next day and it's permanently corrected. It's a pretty cool procedure. It's couple of tiny little nicks. It's virtually scarless.
And people are so grateful. I think a lot of women go through life with inverted nipples and they're bothered by them, but they don't even realize that there is a way to correct them.
Yeah. So that's a great one. That's
a good tweakment. Lasers, do you want to talk about that?
So lasers, we can like touch on that because the truth is that could be a
whole topic in and of itself.
Why don't you pick the 2 laser tweakments that you like best?
Okay, so when I think of the best, if I'm going to evaluate what makes a good tweakment, I would say the biggest bang for your buck, but I'm not really talking about money, but I'm talking about your biggest result for little downtime.
Okay.
So to me, improving the tone of your skin, which is the color, that is the best. So the BBL, broadband light, is my absolute number one. Gets rid of all the redness and brown pigment on the surface of your skin. And
any downtime?
Okay, it depends how you define downtime. No social downtime. You can go about your day, go about your evening, but depending on how it's done, how aggressively, it will bring out some of the pigment. So what used to be light will now get a little bit darker. No one else is going to notice but you. And as the pigment breaks up, it forms these teeny little granules, almost like sand granules on your skin that, again, no one else is going to see but you. And
They fall off?
they're gone in a week. Yep.
Okay.
It's basically the laser is breaking up the pigment into these tiny little particles that the body clears. And what I like to explain to my patients is that when light hits your face, the light gets absorbed by whatever pigment you have on your skin, under your skin. But if you can get rid of that pigment, the light bounces off and you reflect light. You look younger. Your skin looks lifted.
Sounds deep.
It's both superficial and deep. So the BBL is one of my favorite tweakments, and I often combine it with the Pico Shore laser, which is another awesome tweakment with zero downtime, literally zero. And that gets the deeper pigment as well as fine lines and wrinkles, stimulates collagen. It's really a great laser.
So who are the candidates for these lasers?
Good question, Elie. Okay, so
I don't have the answers. I just know the questions.
Almost anybody. However, with BBL, I do not do BBL on very dark skin. Or if someone has a fresh suntan.
No sunblock?
We don't do BBL because the pigment from the suntan is going to compete with your pigment for the attention of the laser. So not a good idea.
Okay.
Pico Shore, on the other hand, I can use on darker skin tones, depending on how I do it. And it's very successful on all skin types. So really, I would say anyone who needs the Pico Shore laser is a candidate for it. And I have patients of all ages who love it. I even use it to get rid of acne scars in teenagers. Our own daughters are frequent users of the Pico Shore. And all ages. I use it for pigment and someone my age. Use it
20?
for exactly. Use it for everybody. That concludes our part of the tweakment discussion. And now let's meet our guest.
Yes, we'll welcome Alice Hart-Davis to our show.
Alice Hart-Davis is from London.
Yes, from the UK.
From the UK. She is a well-known journalist and an author, and she started the Tweakments Guide. So Alice, thank you for joining us.
Thank you so much for asking me.
It's great having you here, but we didn't really have great planning because we were just in London for a wedding, and we probably could have done this in person. That would have been a lot of fun.
That's right. We had a wonderful weekend in London.
Yeah.
We could have seen you. Anyway, we know that you are a very well-respected journalist and author in London, and author of the Tweakments Guide, which
thank you.
I've checked out and I find it very informative. And we wanted to talk to you a little bit about tweakments because that is the theme of our podcast today.
For sure.
So how did you get into this?
Okay, I have been a journalist forever, and I started writing about beauty and also aesthetics about 25 years ago because I was on an evening paper in London, and the boss said, there are these doctors out there, they're doing stuff to people's faces, with lasers and things. And I said, well, I don't know. And she said, well, get out there and find out. So I started blundering around and asking, and there were a few, hospital dermatologists using lasers, a few people injecting toxin, but the whole aesthetic medicine industry, as it were, was absolutely in its infancy. But I've been able to follow it since then, reporting on it. And as you say, now I have a content platform which is just full of information. It's like an online encyclopedia of all non-surgical stuff for people who are curious, because this is such a confusing area.
It really is, and I think your coverage of it is fabulous. Do you personally get each treatment done to yourself?
No, but I have over time tried an awful lot. I only one face, so I don't get through everything, and often the procedures I'm not a good candidate for them. But I have tried out an awful lot, because just when this was all coming along, when I was getting into this, I was in my late 30s, and it's at that stage of life where you start to see your face not looking maybe as you would have liked it to. And even though all my young colleagues were saying, I'd never have a poison injected in my face, I would sit there and think, you wait, sweetie, you wait till you're looking down the barrel at 40 and you see those frown lines and your mum is saying, why are you looking so anxious? And you think, is it so bad to try? So I've tried a lot. So yes, I've tried many types of fillers and energy devices and all sorts of stuff. And I've tried them in order to write about them. And I try always to write as I find, i.e., it's not necessarily going to be a 100% flattering piece particularly if it goes a little bit wrong, as some things have done over time. But it's such a fascinating area because it has had such an astonishingly fast evolution over the past 25 years.
Definitely.
Because when it started off, there were a few people injecting a few things, and then in the noughties, 20 up to 2010, there were all the hyaluronic acid fillers were developing and more different types of them, and then the energy devices start coming in. Because way back it used to be, I mean, you'll notice it was, if there was a line on the face, people would either fill it or freeze it. But it's got a whole lot more varied and subtle since then, hasn't it? So the last 15 years have all been about the energy devices, ways of stimulating collagen, refreshing faces that barely need it yet. It was all about anti-aging. Now, then it became about beautification and reshaping faces, and now it's all stimulating collagen for people who haven't lost it all yet. And also the regenerative medicine. I mean, it's huge everywhere globally, isn't it? And that seems to be what all the practitioners are getting into here in the UK, whether that's using your body's own resources to help your face, whether that's fat grafting or using the stromal vascular fraction or something to improve the skin, or whether it's using polynucleotides or hyaluronic acid-based skin boosters, which I know you haven't really got over in the States yet, or you probably have, but they're not sort of quite FDA cleared yet, most of them.
Yeah. For example, something like Skin Vive is cleared for us on the cheeks. In Europe, it's cleared for use on the neck, right? The décolleté, the neck, elsewhere.
Yes, and that's a great one, and it lasts a good long time. But the one that everybody's mad for over here is Profilo, because it involves so few injections. And I know that hasn't got FDA approval yet, but these things great. What fascinates me most about this area really is that way back when, there was nothing that a woman in midlife could do to manage her looks as she aged, between skincare and surgery. And into that gap has come all this stuff. So now, if you do want to do something about how you're looking, and you don't like these signs of age that Mother Nature is kindly handing out to you, you can have a go at it, whether it's just brightening your complexion, taking off a bit of extra pigmentation, or whether it's full-scale revamping it, or having a facelift.
Right.
You've hit, I love the term that you use, it's in its infancy. And it kind of harkens back to that old adage in medicine. It holds true in probably a lot of areas that if you stop learning, then you might as well retire. And yes, you're right. When collagen was the only thing out there, and Botox and that was that, compared to now, obviously there's been a burgeoning of all kinds of things. But at the same time, every year I still feel like we're in the infancy of things as more and more technology, more and more
it's true.
is developed.
You cannot stop learning in this industry, and you have to bring in something new every year, and at the minimum, but probably even every half a year, or you're behind.
I mean, that must make it really difficult for you guys, because at least I'm just going around trying to find out about stuff. But, I go to all the conferences that I can possibly cram in, because that's where I really can pack in the learning about what's new and hear about what's coming up, but also where I see so many colleagues from around the world And I'll bounce up to them saying, oh, I've heard about this amazing thing. It's so great. Everybody says it's fantastic. And they say, well, hold your horses a minute. Have you actually seen these studies? They're fairly thin. They think, oh, no, don't burst my bubble on this. But it's very valuable. It's really the only way I learn, because obviously I'm not a medic. I don't have degrees in research or how to read complex clinical papers, but I can go around asking people questions, and I do. And if you ask enough people questions about enough things, you start getting a more rounded picture of the procedure or
Right.
I do love that you're trying these things out, because
I'm vain. I'm getting old.
Well, it's not just that, but it's also that there's certain areas in medicine where there's very much data driving it. So protocols for treating certain skin conditions or medical conditions or cancers or things like that. In the aesthetic industry, the science is there and conceptually it's all there, but everything doesn't always work as well or as effectively as we want it to. And the truth is, even with us, we have to play with things and tweak it and get to the right settings to feel like we're getting the right effectiveness. And sometimes things come and go because they're not as great as we'd hoped they'd be.
Right. So along those lines, I'm curious to know from you, how long do you wait from the time a procedure is new till you write about it? And how many people do you ask? What are your measures for judging something?
Well, yeah, I attempt to do whatever due diligence I can, and I'm a bit more careful and cautious about it than I used to be. I mean, there were instances way back. Do you remember a product called Macrolane, which was in the Restylane family? It was billed as the injectable boob jab. Of course, as journalists, we were mad keen to be the first to try it out, and did, though unlike the other products in that same stable, it really hadn't been tested thoroughly. There was a study somewhere, but it was in Japanese. Had any of us got it translated and looked at it? No. And then only a year later, the problems start becoming more apparent. And I think 5 years later, the whole thing was taken off the market. And I was lucky that I had the treatment. It was fine. It became encapsulated, but that wasn't the end of the world. But I have had so many letters over the past however many years from women who've had bigger problems than that. So what I'll try and do, I mean, if it's a device or a product from a well-known manufacturer, that's a good start. How long has it been around? Is it legal? In the UK, most things are legal, but exosomes, human-derived exosomes aren't. So I can't. Lots of practitioners are doing them here, but I can't go and try them because either I look sort of vastly ignorant or complicit in that, like, oh well, it's
right.
A lot of the doctors say, oh, it's fine as long as you don't inject them. And I say, no, it's not. They're human-derived ingredients, so it's very clearly illegal according to the European rules, which the UK still subscribes to. Does the product have FDA approval? It might do. There are some things which are coming, sort of left to right around the world, and they will have FDA approval before they arrive here. Or has it even got?
It's usually the other way around, though.
Right.
It's usually the other way around because because the UK, everything gets tried here because there's so little regulation. And I will ask the brands what this thing is, why is it good? Why is it different from what's come before? I'll ask the practitioners who are using the products, their key opinion leaders. I'll also ask the practitioners who aren't using them what they think. And, it's a fairly small industry, and I've been in it a long time. So there's loads of people I can hit up on the WhatsApp to say, have you heard of this thing? Is it any good? Is it rubbish? Or I'll ask the competitors who will start dissing it immediately.
Right.
So
that's a great approach.
Otherwise I feel so gullible a lot of the time when I practice saying, oh, this amazing new thing can do these things, and then I find the reps from the other companies coming in saying, yeah, right, you've been taken in again by and I think, well, I'm trying because I'm just trying to communicate with the consumer what these things are, and if I'm finding it difficult to understand what all these things are and where they fit in and how they're different from each other and whether they're worth spending money on. The poor consumers, the potential patients, are really baffled, and
Right.
I'm
Yeah.
just trying to give them a steer, and I can't give them advice on what to go and do. You know, I
Right.
get a lot of
Exactly.
incoming on Instagram saying, I've seen this person, they say this, I've seen this one, they say the other. Which should I do?
Yes. That's why I like what you said initially, that you don't try everything because some of them are not right for you. So I think
No.
one of the most important points is that you're providing education for people so they know what's out there. But then the consumer needs to go to their doctor, their hopefully medically licensed doctor, who will analyze and assess and further educate the patient and say whether or not it's the right treatment for them.
Yeah, because it's true. There are many times a week where someone comes in saying, my friend did this, I want that same thing.
Right.
And like, you know, it is not for them. It is not the right thing. And yet
Or
they really want it.
Or perhaps it's not going to cause any harm, but their money can be better spent in a different way. Like you know, I have lots of patients who will come in asking for Morpheus laser, which is radio frequency laser with microneedling, and their face is filled with sun damage. And what they really need initially is a photofacial, you know, or some laser, one of the lasers to get rid of all the pigment. And it's not really tightening or lifting that they need. It's more skin tone correction. So it really is important to let the doctor assess what is best for you. But I think what you have provided is fabulous.
Thank you. I mean, all I can say to people is go and find a good practitioner. And I know they're not cheap, but you know, this is your face. You want to get it right. You want somebody who can do this education piece that you say is so vital. Otherwise, they come bouncing back to me in the DMs on Instagram saying, well, I went to see that practitioner and I only wanted, you know, my lips done, but they said I needed this and that and the other. And I thought, oh, and did they not explain that you're 55 and you haven't done anything to your face, so it might be a little more than just inflating your lips that will give you whatever the changes you seek to make in your face. It's really tricky. But you know, well, most good practitioners can absolutely do that, and they will explain what and why and give the time so that the poor patient who, because I don't know, I still find if I go in somewhere as a patient and I'm focused on having a procedure, I get like a rabbit in the headlights. I can hardly take in what they're saying.
So true.
And there's a part of my brain that's still in denial about the fact I'm going to try this thing. And yes, at the same time, I know this could be the procedure that leaves me having to wear a paper bag on my head for the rest of my days, because you know, because things can and do go wrong. You know, I had the worst thing I've had go wrong was it was a procedure, it was a laser, it was near the eyes, so standard practice is to wear ocular shields, you know, like the metal contact lenses they put in. And I don't know whether there wasn't enough lubrication or they were left in too long or whatever, but the shields ended up ripping off 6 by 8 millimeter patches of epithelium off each eyeball.
That's horrible.
It was so horrible, and the sort of shock of it sent me into some kind of post-traumatic, just shaking. I was in bed for months, kind of unable to kind of try and breathe properly. So, which wasn't funny at all, but you just think, oh, that should never have happened. And all my laser and oculoplastic friends were sort of WhatsApping saying, I can't believe, you know, we've used these things, that this has never happened to us, you know, you were very unlucky. And think, well, then at least people know I can put it out and say, yeah, you know, I can be unlucky too, but you can't guarantee. And as you were saying before, it's so hard to, you know, guarantee anything with non-surgical procedures in the way of, you know, will people get the results they've seen in the before and afters of some pictures? You know, those are ideal. Those are what you could possibly get, but your results may be different. Your collagen's ability to boost itself and tighten over time.
Correct. And it depends on age and, you know, your health.
Totally. So,
and other factors.
Managing expectations around things.
It's one of my mentors from the we're going back, close to 20 years, was from the UK originally. And he used to always say, it used to throw me. I didn't particularly love it. He used to say, "It's not better, different." And I was like, no, that's not good. So getting back to the, different isn't good. Better is better.
Yeah.
Thank you so much for joining us on our
Thank you.
podcast. And all our listeners should check out the tweakmentguide.com. Is that correct?
The tweakmentsguide.com. It is. Thank you so much for inviting me. It's been an absolute delight talking with you.
Our
You
pleasure.
as well.
Thank you. Have a
Take
great
care.
And this concludes our latest edition of Beyond the Scalpel.
Thanks. We'll see you here next time.